have you with us in this edition of the Urban Debate. Over the next 2 hours, we will continue with our focus on COVID. Some very, very dangerous and scary statistics, stories of human tragedies and new trends that have emerged. But before we go on to bringing you those, I have a special guest joining us on the top of this edition of the Urban Debate, Uttar Pradesh Minister Sidharth Singh. And we speak to Sidharth at a time when Uttar Pradesh has registered its single highest spike of over 20,000 cases. And it's been on the rise now for several days, as is in several other parts of the country. So let's try and understand what is the situation on ground, mixed reports coming in, and how is the government planning to tackle this. Good evening, Mr. Singh, and thank you for speaking with us. Let me begin by asking you, to what do you attribute this sudden spike that we've seen in Uttar Pradesh in the last few days?
Well, this is a particular strain where the multiplication is much higher. And we did realize that during the Holi and because of harvesting season, many of them have come from other parts of the country where the COVID was on the rise. And therefore, it has its own impact on it. But at the same time, the government is making all the necessary arrangements which are required as far as the infrastructure is concerned, testing is required per day, daily testing is required, vaccination is to go on, and availability of the doctors in L1, L2, and L3. So all these things are being screened and also made available to the patients. So there is a streamlining which is going in the state regarding the COVID patient.
Of course, and this is a question I asked several other states and ministers from different states, Mr. Singh. Do we now feel that we didn't learn the lessons from Maharashtra? Maharashtra was the leader ahead of the curve. Even in the first wave, things got really bad there first, and then in the rest of the country, Kerala and Maharashtra, this time around too. But for some reason, a lot of states are now being caught off guard with not enough infrastructure ready, not enough drugs and vaccines ready.
Well, I don't think UP will fall in that category because UP did ramp up their testing labs. We started with 0 testing lab. We were sending it to Pune and to Delhi, but now we have over 250 our own labs, private and the government lab. We have created more medical facilities through medical colleges, more beds. So all put together, we have an L1, L2, L3 about 1.5 lakh beds. So all these things have been taken care. But at the same time, we must also realize that when you work on any program or you plan, there is a precedent, and the precedent is always of for in this case, let's say the COVID virus was there. So we had seen how exponentially it was jumping. But you didn't realize that, we'll be, we were always looking at the British strain, but we didn't realize that there is going to be a Brazilian and the South African, and we are hearing about the California also strain coming into the country. So obviously these are off-guard thing in the pandemic that we are seeing. But at the same time, the government's job is to serve the people. The government job is to address all these challenges. So that we are doing.
Allahabad High Court recently, in one of the hearings suggested that the government look at lockdown-like measures, Sidharth Singh, and the situation in Uttar Pradesh is extremely serious. Is that something that you will seriously consider?
Well, certainly it is serious. We can't be in a denial mode. But at the same time, I don't particularly see, as a cabinet minister, I don't see that it is for the entire Uttar Pradesh, this lockdown situation. There are a particular 8 districts out of 75 districts where it is rising, and particularly there are 4 out of 8 also. There are four districts where there is a rise. So we have to address from that angle. But nevertheless, since the High Court has said to us, the government is taking it seriously, and we have to, I believe the next date is on the 19th of April. The government will go with their structured response, and accordingly we will address that issue.
Mr. Singh, one other big issue that has emerged from Uttar Pradesh is the data mismatch when it comes to deaths. What the state's official figures for the last 1 week would be roughly 124 deaths. Of course, today we've seen a bigger rise in that. But if we look at the individual hospitals and the breakdown that the hospitals are actually showing, even in the city of Lucknow, it's gone beyond 400. There is a mismatch here. To what do you attribute it? Lack of communication or a difference in opinion or something intentional that has happened?
No, well, if there is a reporting system where in the command and control system, which is available in all the districts, so any hospital which is a COVID hospital, they report about the deaths, they have to report on that through that system. So if and they have to give the reasons of the death. So if they have given the reason, then it's collated. It's you can't tamper with those data. So that data is something which is something available, and it can be always audited also. So one really cannot. It's a software. You don't enter that software and try to tamper with it. So it is a transparent system. So whatever data they are providing and putting it across has to come from them, their hospital. So we don't go around and collect it. So the system allows them to report themselves. But at the same time, if somebody is coming up like in Lucknow 400, I really don't know from where they have got the these reports and from where they have collated that data.
So actually, let me clarify on that. The 400 figure is actually coming from the crematoriums. Together, the crematoriums have burnt 400 bodies when the official number of COVID deaths is 124. Now, it is, of course, difficult to believe that rest of them were non-COVID deaths.
Well, Tanvi, you are a senior journalist and you are an experienced journalist. I don't think every death can be attributed to COVID, whatever goes to a crematorium. And when it goes to a crematorium, it has to be also certified whether it's a COVID death or non-COVID death. So the data comes, data needs to be taken from there. So my own personal request would be that these kind of data, one shouldn't believe into it and create a panic. So let's keep that aside. Whatever the government is coming out, they are transparent and they are very reliable.
But I would urge you, Mr. Sidharth Singh, to actually do go back and look into it. If the crematorium's record suggests 400 bodies burned, COVID bodies burned, and the official data doesn't, it could perhaps be because you don't factor in comorbid deaths as deaths due to COVID. It could be something else or misreporting. But if indeed it is true that we are looking at such high number of deaths in people who are infected with COVID, it would require a change of policy from your end. The government will have to prepare itself with higher number of ambulances. The crematoriums will have to be prepared accordingly. The sense of seriousness that comes in tackling these cases will also have to be looked at, which is why I feel this is important.
I think that you are believing that it is true. Now, I can't really make you say that no, it is not true, and to make you believe. But I can only assure you, whatever data is being brought in the public domain by the government through is very transparent and reliable.
Okay. Fair enough. Two other important aspects today. One, of course, is the return of the migrants. Mr. Singh has begun again. We've done exhaustive reportage from Maharashtra, from Karnataka, even in the national capital. Has the state yet again begun to prepare to track these migrants, their return? Will they be quarantined? Is there a policy there?
Yes, we have already initiated 2 days back. Those who are returning, they will be quarantined, they will be tested. And accordingly, and whenever they go to any village also, a village or a community reporting system has been initiated, and Anganwadis and Ashas have been already roped in. So all these things have been taken care, and certainly they will be quarantined and if required, isolated also.
The other aspect, of course, is the large congregation that is going on currently in Haridwar. Now, while they have now stepped up testing and they're doing random sample testing of 9,000 on a day, hoping to do 20,000 tests a day. There are cases that are emerging of positive cases. Is there some kind of system you're putting in place to track the returnees from Kumbh Mela into Uttar Pradesh? Surely there would be a large number who've traveled from this state there.
Certainly. Certainly, we are all the borders, at all the borders, at all the bus stations, any trains coming from there, we are tracking them. So there is a testing, testing, tracing, and treatment. At the same time, we do contact tracing also.
No, but would this be at the borders for everybody who's entering Uttar Pradesh, or those specifically coming from Kumbh Mela?
Well, they are coming from Kumbh.
Right. So for those people, the devotees specifically.
If you are coming from Delhi into Noida, that's not applicable as of today.
Okay. Okay. The other aspect is on vaccination. There were reports earlier when some of the states were witnessing a shortage, even from places like Ghaziabad and Noida, where our own reporters visited the vaccine centers. And they had halted and suspended the vaccination. Are you now looking at a comfortable dosage with you? And how is it that you're getting it from the center? Is it on a daily basis, weekly basis? If you can enlighten us on how this system is working.
Well, as of today, we have received 1.25 crore doses from the government, from the center. And out of that, approximately 90 lakh people have been vaccinated. So there is enough stock otherwise. And at the same time, in next day or two, we'll be receiving another batch of 8 to 10 lakh more doses. So I don't see that to be a problem anywhere in Uttar Pradesh.
Mr. Sidharth Singh, my last question to you. I know your state has now asked for additional remdesivir drugs to be flown in from Gujarat. You sought help from the Gujarat government on that. But there are other aspects as well. Law Minister Brijesh Pathak himself, in a letter to the UP Chief Secretary for Health, pointed out issues about lack of ambulances as well as beds, saying that people are not responding for ambulance calls, even for testing. There is a huge amount of problem. I believe he went through it, or somebody he knew went through it. Who is looking after these problems right now as cases begin to go up?
It's really unfortunate that this emotional outburst came from our esteemed colleague, Brijesh Pathak, because I have spoken to him yesterday also, I spoke to him today also, and it was his own personal relationship or a family, old family ties with the late historian, late Mr. Praveen. So because of that, it had happened, and they were unfortunate. He came out, and there was nothing but I would attribute to an emotional outburst.
You would say that was just an emotional outburst, but not a larger problem on ground, because one would see him reacting also like any other citizen would if they had to go through the same struggle.
Well, I can only say that since I have spoken to him, and I'm quite clear, it's an emotional outburst, nothing else.
Sidharth Singh, thank you so much for giving us your time. I hope your state is able to tackle this crisis and hear out the voices of people and the problems that they're facing. I also hope Chief Minister Yogi Adityanath recovers quickly. He's also tested positive and is currently in isolation. So for the state, it's a huge challenge, right from the Chief Minister to the common man out there, with over 20,000 cases being registered in one single day now in Uttar Pradesh as well. Remember, many of the devotees would have traveled all the way to Kumbh Mela. We don't know what the repercussions of that huge congregation is going to be, but cases are emerging from Kumbh Mela already, albeit at a lower level of testing that is being carried out, lower level of check that is being carried out at Kumbh.